Hello. I don't know if anyone's watching, but this is Dr. Alex's office hour. We're just trying out this Facebook Live. First time we've done this. Like usual, I'm a minute or two late. Um, yeah, we've got comments are open down below. You can put in any questions. We've had a couple questions submitted in advance, so I'll go over those. And yeah, it's just really in the big picture, healthcare is a system, and it's a system that you have to navigate. And a challenge faced by a lot of people is access to a family doctor, whether you have a family doctor and can't get in and see them, or whether, you just gain initial comments. Great to see that Anita's on and Bridie's on. And yeah, so, the big challenge is whether you have access to a family doctor, whether you have, even if you do have a family doctor, whether you are able to get in and see them. And so there's a lot of family doctors that take 3-4 weeks to get in to book and see. And often if you have an issue, you need to see a doctor right away. You need to see a doctor, nurse practitioner in the next week and navigate whatever it is that you're presenting with. So that's one of the big challenges initially. And so, yeah, so today's just an opportunity to try out this Facebook Live. It's a new technology, and see if it's any help for, patients, followers, otherwise in our community. And yeah, there's a lot of misinformation in the world right now. And so we can see a resurgent measles epidemic in parts of Texas, in Ontario, new cases popping up in BC. This is something that historically hasn't been an issue. We were close to eradicating measles, in fact. And because of declining vaccination rates, because of more misinformation about how to, treat and alternative remedies, and frankly, snake oil and things that are not very helpful, have come back, and it's scary, right? I've just had a newborn daughter, and she isn't vaccine protected until she gets her first shot, and even in the weeks after that, a year of age. And there's other people that have waning immunity, and so one of the things to keep in mind is that you can get a booster, and the more you hear about it, and that might be something to explore with public health, is whether you get a measles booster. And so for those in BC, you can check out the BC immunization schedule. That can be a helpful tool to figure out whether or not you need an updated vaccine. One of the things I often say with patients, and we've got a great question from Bridie that's just come up on the screen, so I'll get to that in a sec. Thanks very much for putting that up. Is just around what are the sort of key things that we can do to look after ourselves. And so, obviously, part of it is getting the basics, right? So hygiene and otherwise are really key in terms of, what has made a difference in terms of, public health and helping reduce the rates of newborn illness, of not only newborn illness, but prolonging and allowing people to live longer, healthy lives. And so public health interventions like clean water, like access to toilets, those have been the 200 years ago, when there was the classic cholera outbreak in the UK, where public health was, you can say, invented. That is, where we took the first step to recognize that clean water, sanitation are really important. to people living longer. And then we had an opportunity over the past 100 years to have vaccines developed. And, up to the point where we had during the COVID pandemic, within the matter of 4 to 6 months, you had a mapped out mRNA new technology vaccine that proved to be really valuable. So I guess to get to first couple questions, Bridie had submitted one in advance. How to navigate the system without a family doctor. That's, not easy. And I think one of the things is we've struggled to have access to walk-in clinics. And on the North Island, Port Hardy, where I'm based, we do offer a walk-in clinic 4 days a week. That makes it easier. But, I'm not saying everyone should drive to Port Hardy for healthcare. Certainly figure out what you need in terms of your care. And I'll go through a summary in terms of, age-related needs. And a lot of the things you can start to address without having a family doctor, without having a nurse practitioner. Of course, the best thing you can do is get on the BC Health Registry, get lined up with a new family doctor, or at least get on a wait list for a family doctor, depending on where you're at. And so, but there are, certain things that are tricky in terms of getting a referral to a specialist without a GP, as Bridie asks. And, that's how, this medical system works, is everything's designed around responsibility. And so, the role of physicians and in doctors in the system is that we have a medical license, we have medical legal liability protection. So if we do something wrong, we have potential backup, and we have the ability to navigate the system, help our patients, but the patient can point to the doctor and say, well, you did something wrong. If you don't have a doctor, there's no one that's going to take responsibility for your health in the system. And that's a hard place to be, because specialists and specialist doctors, so if you need to see a dermatologist for a skin issue, they rely on writing back to the family doctor and saying, well, deal with their diabetes or deal with their heart disease, because my focus is on the skin issue. So, we've brought on over 1,000 new family doctors in BC in the past 2 years. So at least in BC, we are getting more family doctors. We ultimately need a system where everyone has access to primary care. And there's a fantastic book that I'd really encourage people that are interested in access to primary care and how to navigate the healthcare system, a book called Health for All, A Doctor's Prescription for a Healthier Canada. And this was written by Dr. Jane Philpott. She was the Canadian Minister of Health in 2015 to 2017. And she, is very insightful, recommends essentially that we do what we're trying to do in the North Island in Port Hardy, which is to create a health center that provides health care for a geographic region. And so much as, you wouldn't have any questions about getting your kids into a public school based on the neighborhood that you're living in. So based on the neighborhood you're living in, you should have access to a family doctor. So, but again, back to this question, how to get tests without a GP. There are certain tests that you need to have done. So, everyone needs to have a stool test or a colonoscopy for colon cancer over the age of 50, and if you've got a family history, over the age of 40. So, you can go to the nearest either Life Labs or hospital and ask for a stool test kit. And so that's an option, and that's a screen. And there's the BC government has the BC Cancer Association that at BC Cancer Organization that will screen without having a family doctor to receive the results, and will arrange for you to have a colonoscopy if you need one. So that's, really positive that way. We've got different tools. So that's, one thing I'd say is that if you're over 50 or over 40 with a family history of colon cancer, you need to get screened. You can get a colon cancer kit. That's called a fecal immunochemical test kit. And so you go to your nearest lab, Life Labs, hospital, request a kit. That kit will be sent, and you can also access it online. I'm just going to, as we go, pull this up. I'm trying to, again, I appreciate everyone's patience. This is my first time doing this live video, and so it's a new system, and yeah, it's a neat way to try and reach a broader group, and sometimes people without access to family doctors. So we've got 13 people watching now, so I really welcome everyone joining. So if you go to BC Cancer website, bccancer.bc.ca, or just Google FIT kit, and you can request a kit online. So and you basically go get screened, fit, and you request a kit. And there's also virtual resources. So to Bry's question, without a GP, we do have TELUS My Health. We've got various online walk-ins. So I'd encourage you to, as I said, Google BC Cancer screening, and there's various resources for how to get tests without a GP. So that's part of it. For women and people identifying as a woman, you have to have breast screening over the age of 50, and really recommended over the age of 40. I'm going to just verbally give you a couple phone numbers. So if you need access to mammography, which is breast cancer screening, you can call the number 1-800-663-9203. Similarly, for cervical cancer screening, so for all women over the age of 25, we've got in BC this new system where you can, essentially get screened, yourself in the comfort of your own home, not need to have the invasive and uncomfortable procedure of a pap test. I identify as a man. I've never had a pap test, but I certainly have done lots of pap tests, and unfortunately have, contributed to discomfort. And so we've got, in the past year, a new screening system that's more effective in capturing cervical cancer. That's BC Cervical Cancer Screening. So people can request a kit if you're over the age of 25. 1-877-702-6566. Again, the phone number is 1-877-702-6566. So I've got a few more questions, and a very kind comment from Blaine, and that's very kind. I appreciate the feedback. And we've got a great question from Anita, who's one of our great supporters in the community, around how many cortisone injections can be put into bone-on-bone knee when you've had to wait years for surgery. And so this is a tough question, right? Because arthritis is an age-related degenerative issue. So it means that what's called synovial tissue, so there's cells in between the joints of your body, and we've got joints all throughout, our hands, our feet. The big joints in the body are the shoulders, the knees, the hips, and the knees are mostly affected. So this person's asking about knee injections. And so for osteoarthritis, steroid injections give symptomatic relief. They don't actually fix the problem. So what I often do, and I do a lot of steroid injections for patients, is, I explain that this isn't going to fix your underlying knee arthritis, but this may give you some pain relief that can get you moving. And the fix for osteoarthritis is movement. Motion is lotion. The more you move, the more the synovial tissue, which is again the tissue between the joints of the body, between the bones of the body, in the joint, in that basically fluid, synovial fluid, which is like, if you think of the Tin Man, and for those that struggle with osteoarthritis, you definitely can identify with the Tin Man and creaky joints and otherwise. Synovial fluid helps to lubricate. And so that's what we're actually going for, is we're trying to improve your body's ability to produce synovial fluid, something that you lose with osteoarthritis. And so, the synovial fluid can be helpful. So where a steroid injection is helpful is if it gives you some pain relief that lets you get, for knee arthritis, on the bike. And the best thing you can do is get on a stationary bike and put in 15 to 20 minutes every day on that stationary bike. That will strengthen your quadriceps. That takes pressure off the knees. And so you get from this bone-on-bone effect to a cushioning effect of having the quadriceps muscle engaged. And so that can be, very helpful. But in terms of number of steroid injections, there isn't any hard, fast rule. Typically, we say maximum every 3 months. There is another option you might explore with your doctor called Synvisc. It's a hyaluronic acid supplementation, something that we inject right into the knee. Same injection site as for the cortisone injection. But again, there isn't a lot of evidence that it helps too much. The most evidence is quadriceps strengthening. So again, exercise bike. If you don't like the exercise bike, the pool can be helpful. But it's tough, and some patients struggle to be able to leave home due to pain, and that makes that more difficult. So I'm sorry I can't help more. That's a bit of a struggle. We've got a few more questions and some kind comments. Nice to see Harriet on here, and Bridie, kind comment. Yeah, so in terms of the question of whether the injections are safe to have, they are. So it's a clean prep. So we use an alcohol swab, and essentially ensure that things are sterile. So the risk of an infection is less than 1 in 1,000, and even if you do have an injection, it's typically just a local bit of redness that you can treat with polysporin and a Band-Aid, so something that you can manage yourself. And so, these are things that may be an option. So hopefully, if you are lucky enough to have a family doctor, primary care provider, and you're struggling with knee arthritis, a steroid injection may be an option for you. Same goes for if you're having shoulder pain. If you're having hip pain, we have to explore whether it's a bursa, infection, or more inflammation, I should say, or actually in the hip. So we've got a question here about how to detox from an mRNA injury. And so, that's a tricky question. I'm not an expert in adverse effects from mRNA vaccines. This is referring perhaps to the novel COVID shots that started in 2021. And, they were associated with an increased risk of some side effects. And, this is an area that I'm not especially well versed in, but I'd be curious what the person asking in terms of how to detox from an mRNA injury. Just what they're asking is how to recover, I guess it is. I often find, part of my doing this Facebook Live today, and hopefully again in the future, is to explore, how do I, as a physician, someone who's got, 13 years of education beyond high school in becoming a doctor, in navigating the healthcare system, navigating the science, navigating the evidence-based practices. And so what I'd say is, we can do that together, and we can do that together while we're here online. And I've got my laptop here in front of me. So, Google is a great tool, and there's, often you can see those mugs, that I've got colleagues that have them that say, my doctor or my medical degree does not replace your Dr. Google. But Dr. Google's actually really effective, and knowing how to navigate the healthcare system and advocate for yourself is great. And so I often, with patients, in the room, will pull up Google and we'll go through together my thinking system, and go through how I, navigate and think about the healthcare system, and think about, health and active medical issues. So again, to this question the person's asked, how to detox from an mRNA injury. So I would reframe that a little bit. So I would suggest that you can use the word recover rather than detox. Detox is a word that gets used a lot by naturopaths, by alternative health providers. It's not a word that we see very much in the medical literature, except, so it's something that often is brought up in the context of thyroid issues, of colon issues, and it's not clear to me that it is a scientific word. And so I just caution you, when you're exploring on the internet, when you're using Dr. Google, to try and be a bit scientific with your words. So what my question would be how to recover from mRNA vaccine related adverse effect. And so when I Google that, there's a number of links from, and this is a good place to go, is the National, this is listed as a National Institute of Health article, which is, a good place to start. That's a collection of scientific publications that can come from around the world. They're procured, looked after within Canada. Within the U.S., I should say. Another good place to start is the Canadian government has a whole website in terms of COVID-19 vaccine safety and side effects. So I know the author of the question has noted that it was a bad batch. So the first thing I would do is I would go to the Canada.com. So Google what I said to Google, which is how to recover from mRNA vaccine-related adverse effect. And then from there, the second link is COVID-19 Canada, Government of Canada. You can scroll down from there, and there's a vaccine injury support program. And so, you're eligible for supports, but there's also an opportunity for a physician consultation. And again, the nature of this Facebook Live today is that I can't, and I looked into it a bit, I can't medical legally give one-on-one medical advice because I want to protect your confidentiality and your medical history and otherwise. But I can provide general guidance. So for example, how to Google medical issues and how to navigate the healthcare system when you don't have a family doctor are really good examples. So, but yeah, I'd go through this vaccine injury support program. There's an opportunity for physician consultation through that. But I'm very, mostly sorry to hear that you've had a bad experience. And I certainly recognize your name as a patient of mine, past patient. And so it's sad for me to hear that you've struggled since having the vaccination. We know COVID vaccination has saved millions of lives around the world, and that's, irrefutable evidence that that's true. So, unfortunately, part of public health interventions involve risk, and there's a risk that some people are, injured or otherwise. And so that's, all part of it. And so unfortunately that's a tricky situation to be in. So in any case, I'm very sorry that you've had that. So we've got a question that's come up. As a doctor, what would you want every person to do as a healthy start every day that you yourself follow? How is it most important to you? So it's a good question. I have a welcome letter that I give to all my patients when they join my practice. And I sort of end that note that, none of us is perfect. At least of all myself, we all have our vices, our habits, our bad habits, our good habits. But habits, things that we do every day become habits and become what defines our health and our outcomes. And yes, there's examples of the 99-year-old who's still chain smoking and living, great and doing very well. But those are few and far between. Much more common is the person who's, smoked for decades and struggling with COPD and maybe needing oxygen. So that's something, to keep in mind, is the habits we make are critical. So the question here is, how do we start every day, and how do we create good habits? There's a really good book I encourage people to pick up if they're interested in improving their health and improving their habits. It's a book called Atomic Habits by James Clear. I've really enjoyed reviewing that, going back to that. I listened to it on an audiobook. But in terms of habits that I do, I try and get out for a run. So I try and get 20, 30 minutes of aerobic exercise every morning with my dog. So that's sort of, you've got the physical health benefits of the fresh air, getting the aerobic exercise, so the hard exercise, and then I do 5 to 10 minutes of weights. So your goal is 4 to 5 days per week to have some form of aerobic exercise, 20 or 30 minutes. That's good for your heart. It's good for preventing diabetes. It's good for preventing, generally heart disease, stroke, addressing high blood pressure. And then you also want to have a weight-bearing exercise. So that's something that loads the bones, loads the joints, that protects your joints. And so that's all, part of the first step. Otherwise, what else do I do in terms of your question? I've got, the apple a day keeps the doctor away. I have my apple, I have my cup of coffee, and whatever I can, trying to just support Canadian too along the way. But again, in terms of my habits, I've got an Instant Pot. It's a pressure cooker. I get a bunch of grains, things that take, a number of hours to cook normally, that you can put in an Instant Pot and in 5 minutes have them ready. What I'm saying by that is high fiber. So fiber is one of the most underrated components of the diet. It helps colon health. It helps your nutrition, your endocrine, which is your hormonal, your prevent diabetes health. So I have, flax. I have various, grains, wheat berries, and otherwise that I get, and that can be very helpful. And that just, I have one meal in the morning, and actually I don't eat it till partway through my morning. And that keeps me going for at least 6 to 8 hours. There is some, good evidence that intermittent fasting, can be helpful. And a great resource that I'd encourage people that are interested in diet is called dietdoctor.com. And just to preface this by saying, one of the first things that you want to ask when you're looking for health information is, what is the person looking to gain? What is the person looking to make in terms of money off this or otherwise? So you want to rule that out. This is a good free resource done by a family doctor and an endocrinologist that looks at low carb and ketogenic diet. And it does help with meal planning. There's a Dr. Andreas Enfelt, who's one of the founders of it. I think it's very helpful. Another good resource for diet And especially for those of us that struggle um, with blood sugars, so diabetes, prediabetes, is a book called The Diabetes Code. It's got, different recipes otherwise in it. Dr. Jason Fung, and so he's a nephrologist, a kidney doctor, and he's also written a book called The Obesity Code. So great resource to start. Okay, we've got another question from a friend. I've got naturally low heart rate, 40 to 43 beats per minute. Is this something I'd be concerned about as I age? What would indicate there's a problem related to a low heart rate? So this is a really good question. When we look at people like the swimmer Michael Phelps, or the biker classically, Lance Armstrong, you'd hear about his heart rate would be in the low 40s, and my heart rate's typically in the sort of mid 50s. When I'm in really good shape, it's low 50s, and when I'm slacking, it's more in the early 60s. Average heart rate is 60 to 70, but you're right, some people just naturally have a low heart rate. And so that is something to keep in mind, especially if you have other medical conditions. If you have a low heart rate and blood pressure issues and you're on a blood pressure medication, you're more likely to have a drop, or what's called postural hypotension, where you drop your blood pressure, and that becomes an issue because, frankly, you don't want to fall, right? Those of us over 50, if we fall and break our hip, 1 in 2 of us won't be alive in a year just from complications of breaking the hip. So this is a question of, the heart rate itself isn't that concerning, but what are the consequences of a low heart rate? And you're right, as you age, that can become a bit of an issue. So genetically, you may have a low heart rate, but if as you get older, your body's not able to compensate for the low heart rate as well, you may have a higher risk of, just when you stand up quickly, all that blood, the milk jug of blood that is in your body, getting to your head so you don't pass out, not getting there in time, and passing out before your blood pressure recovers. Then you can fall, you can hit your head, you can break. So what I'd say is, it's good to get in what's called an electrocardiogram or an ECG, get a baseline, see what your heart rate is doing. Sometimes people can have what's called a first-degree atrioventricular block, first-degree AV block, and that may explain why you've got a naturally low heart rate. The nature of heart blocks is they do progress with age, and a first-degree heart block has no symptoms, it's asymptomatic, not concerning, but it can progress. You can get second-degree or even third-degree heart block, and when that happens, there's a complete dissociation from the two parts of your heart, from the atria and the ventricle, which is the main pump in your heart. And so first step is, I'd say, get an electrocardiogram. Next step, ask for a Holter monitor, and that's, say, a 24-hour heart rate monitor, and that's where you get more data there. And it's a good idea if you've got a low heart rate to get your thyroid checked, to get your blood counts checked. Those are all things that can play in. But I appreciate that question. That's a good question. So we've had lots of good questions. We had another patient of mine had asked in advance how to live forever. And that's, a really tricky question, because we, as far as I know, don't have anyone who's lived beyond 120 years. But there's a fantastic author that I listen to. He's a intensive care unit doctor, and he has a podcast, a great podcast. His name is Peter Attia. Let's see if I can actually put it in here. Feature this link during. So just stand by. I'm just trying to pull this up. No, maybe it won't let me work. But if you can Google as we go, and a book called Outlive: The Science and Art of Longevity. So this is a great resource. Great book, great podcast. The again name is Peter Attia. The last name is spelled Attia, and it would be my first line go-to if you want to live longer. It talks about some of the issues that we've already talked about today. So regular aerobic exercise, regular weight-bearing exercise, ensuring that you've got good dietary fiber sources, that you're limiting carbohydrates otherwise in the diet. Those are all, key steps. So, yeah, so we've got 10 people still watching. Love to have more questions. So think about, some of the issues that you may have had in terms of your own health, the other challenges that you may have had navigating the healthcare system, maybe public health issues that you're concerned about when you're watching politicians talk about health issues, anything that comes across as something that you've wondered. I'm happy to take questions here. I'll be on for another 17 minutes. And yeah, I'm just going to have a bite of an apple and take a little break, waiting for some questions. So think about some questions, throw them in the chat. Okay, we've got a great question that's just come up about asthma. So asthma is a reversible obstruction of the airways. And so what that is, you've got these two balloons in your chest that are the lungs. And the lungs have these micro bubbles, and they're called alveoli that are where the site of gas exchange occurs. And with asthma, you get in the slightly larger airways spasm of the muscle. So the muscle can go into spasm. It can be triggered by a virus. It can be triggered by dust particles or any allergens. It can be triggered by cold or humidity, as this questioner has put out. And so, it's reversible airway obstruction. So the first word is the key word. It is reversible. We've got good medications called short-acting bronchodilators. So that would be like the blue puffer, the Ventolin, or salbutamol. But it's tricky, right? So in terms of this question, it keeps you from exercising. Humidity, cold, heat, and walking get you out of breath. And tried chair yoga and lasted just 1 minute. Chair yoga is a great place to start. That book that I mentioned, Outlive, The Science and Art of Longevity, talks about chair yoga, gives some examples. This is, one of the good reasons to get good treatment for asthma. And what I'd say the first line treatment, if you're asthmatic, is a combination of a inhaled corticosteroid and a long-acting beta agonist. So the trade name for this is called Symbicort, and you use it twice a day. And it helps settle things that way. Exactly, I can see your follow-up question. The short-acting didn't work. Yeah, so twice a day now is where when it's indicated. But it's this is as I say, a reversible airway obstruction. Part of it relies on a good cardiorespiratory system, and that takes gradual effort of training and retraining. And if you've had health issues, there's some deconditioning that's occurred. And so you have to recondition your healthcare system, your body, and recondition your system. And so starting, if you can only do a minute of chair yoga, try less. Try 30 seconds, and you might do 30 seconds 2 or 3 times a day. And slowly build that up to 45 seconds. And you have to find where your limit is. And this is, a principle in health and wellness, is you find where your upper limit is and you go just below that. And that's the sweet spot. So for example, if you're out for a walk with a friend, you want to walk to have benefit for your heart, you want to walk at the point where you're just slightly short of breath, but you can still have a conversation. Not exhausted and super sweaty, because you can't sustain that. You're not having a good discussion with a friend. And so similarly with asthma, you don't want to be at the point where you're constantly struggling to breathe, struggling to survive. You want to be slightly below that threshold, but you can raise the threshold and raise the point that you have an asthma attack. And so we've got another question, your opinion on ketamine infusions or SGB for ME, so myelitis, encephalitis, myalgic encephalitis, I believe that is. And sorry, just give me a sec. I want to get the name right. Encephalitis. So, yeah. So, okay, myalgic encephalomyelitis. So, chronic fatigue syndrome is the other name, and fibromyalgia. So, and then SGB is the other point in the question. SGB infusion. I'm not aware of what SGB is. So again, stellate ganglion block. So this is a bit of local freezing, so like lidocaine that we use when we cut out skin lesions. And it can be used to target a bundle of nerves called a ganglion. And stellate ganglion block is for, nerves that are potentially in the neck, and it addresses abnormal nerve cells and can potentially treat conditions like chronic regional pain syndrome, perhaps ME, and fibromyalgia, chronic fatigue syndrome. It's a good question. This is, beyond my knowledge. I'm aware of ketamine infusions for treatment-resistant depression. Ketamine infusions can be very effective for treatment-resistant depression. I don't know very much about them for chronic pain. And so that's, unfortunately, I'm not able to offer too much more. What I'd say is that depending on where you are, and I think you are on Vancouver Island, if you're mid to North Island, the Nanaimo Pain Clinic, Dr. Parisier is very good. And the chronic pain clinic can be very helpful. So you can, if you Google Nanaimo Chronic Pain Clinic, the second is the Central Island Pain Program at Nanaimo Regional Clinic, and Island Health has some information about that. I've seen stellate ganglion nerve injections done. They can be helpful, but the ketamine infusions, I'm not sure. So let's get a few more questions. We've got 10 minutes left, so we've got 8 people that are still on, sticking with us. So any questions that you've got related to health, wellness, navigating the healthcare system, who knows, maybe you want to know what it means to become a doctor, what's involved in training, or whatever else. So happy to share any of the knowledge that I may have gained over the past 13 years of training, and since then 13 years in practice as a family doctor. So we'll just give you a few minutes to add some questions to the chat. I appreciate everyone joining. I've got 8 on right now. We've had 22 over the course of the past hour. So yeah, it's been a nice interaction, nice questions. I'm hoping to offer this again every few Fridays. Again, this is an ability for, I've worked in the Lower Mainland, I've worked in Quebec, Manitoba, and I'm now based in Port Hardy. But I've also worked in the Comox Valley for 5 years. So it's nice to be able to reconnect with past patients and offer any support. And again, the trick here, Facebook Live, right? This is a non-confidential space, so I'm not going to reveal any personal health details. But if I can explore some general health topics, help you navigate the system, help you use Dr. Google more effectively, that can be very beneficial. So yeah, so all good. We've got another question: best supplement for chronic pain and headache. So good question. I know, and I'm going to use, in terms of when you say headache, I'm going to assume maybe more of a migraine, which is a chronic recurring headache, classic symptoms that recur. That's what I'm more familiar with. So there are certain supplements that neurologists often prescribe for migraines. Magnesium can be helpful, B2, vitamin B2, so also known as riboflavin, coenzyme Q10, vitamin D, and omega-3 fatty acids. These are all ones that I would recommend. Again, on the vitamin D front, all of us living in Canada should be taking vitamin D 1,000 units daily. If you're low in vitamin D, you can take 2. But for migraine, as I say, magnesium, something to consider, vitamin B2 or riboflavin, coenzyme Q10, and omega-3 fatty acids along with vitamin D. Supplement for chronic pain. Chronic pain is complex because there's, pain is very real. If you have a sensation, if you have a negative sensation, it's something that's actually firing within the body. And so we have to look at how do we address the pain. And part of that is addressing the emotional and then the physical pain. And they overlap. We know that people that are struggling with emotional pain have a higher sensitivity to physical pain, and vice versa. If you're struggling with emotional pain, you have a higher sensitivity to physical pain. So how do we tune down that pain response when it's overactive? And so, one of the things is that we can ask, first of all, what is the physical state? So do you have osteoarthritis? Do you have fibromyalgia? Do you have migraines? Do you have diabetes? Do you have high blood pressure or heart disease? Or do you have cancer? Have you had complications of cancer treatment? These are all things that we would ask and explore, and that would help guide what supplements might be helpful for chronic pain. But again, I'd say a good dose of vitamin D. We've got a question, vitamin D3. That is indeed the vitamin D that you want to take. So vitamin D3, everyone I'd recommend, north of the 49th parallel in Canada should be taking at least vitamin D 1,000 units a day. If you're low in vitamin D, 2,000 units is a good idea. You'll see sometimes naturopaths and other practitioners recommend 4,000 or 5,000 units a day. I would not recommend that. That comes with risks of, increased risk of kidney stones otherwise. And so if you're, any one of us, I take vitamin D, 1,000 D3, 1,000 units daily. You can take 2,000 units if you're low. So so that's sort of that question. I saw the follow-up that it's non-migraine, so more of a tension headache, which is a regular headache. So again, I'm going to use the Dr. Google, see what we get. So tension headaches, supplements like magnesium, so similar to what I said before. So magnesium, riboflavin, which is vitamin B2, and coenzyme Q10. So I would start with those. They have good evidence behind them. So you can see, as I've done over this past hour, I don't hesitate to use Dr. Google. You have to use a good question, make sure you're looking at the appropriate evidence, and artificial intelligence, AI, has taken over a lot of these search algorithms. That's not a bad thing. Just make sure that the resource and that the highlighted evidence that citation, the references is what I'm trying to say. Make sure that the references come from an academic source. So, a university or WebMD can be a good one. Try and stay away from typical .ca or .com sources. You're looking for .org or reliable university-affiliated sources. So we're looking down. Kind feedback. Thanks very much, everyone. And so we've got a question here. Heart patient, are there risks eating a high-protein diet? And is a gram of protein per pound of desired body weight accurate? Doing this for weight loss, not gain. Yeah, so, good question. Those of us, especially, and I've come back to the age 50 a few times. 50 is, it's an age, if you have risk factors, I'd say 40. But 50 is definitely an age where we have to start really looking after our cancer screening, looking after our heart wellness screening. Yes, it starts earlier in our 20s, 30s, 40s in terms of smart decisions. But the reason I say 50 is that that's really where we see a drop-off, a decline in body's protein mass and muscle mass, which is what protein's contributing to. So there are certain examples where too much protein can put strain on the kidneys. So if you have kidney disease, this is where you have to check with your family doctor and get a kidney test done and make sure that you don't have underlying kidney disease. But just as a patient who may have heart disease, history of heart issues, there's nothing that I'm aware of that would limit the amount of protein that you eat. High protein diet over the age of 50 is a really good idea. And you're looking at, healthy sources of protein. So lentils, legumes, limit your red meat. But these can all be helpful sources of contributing to maintaining your muscle mass and being healthy. So we've had great feedback over the course of this hour. I appreciate everyone contributing questions. We're down to the last 30 seconds. I think Facebook's going to kick me off. So I really appreciate everyone joining. Stay tuned, like or follow my page, the Alex Nataros MD page. We will do this again and get questions in advance. I've enjoyed it. I hope you've gotten something out of it. My goal is to help you navigate what is a complicated world, but not a complicated health of your body. We spend years learning how to navigate health and wellness as doctors. My goal is to share that information with you. So I wish you all the best. Thanks for joining today. Okay, bye.